My name is Aimee Shea. I'm the outpatient oncology dietitian at the North Carolina Cancer Hospital at UNC, and my job is to work with patients who are dealing with a diagnosis of cancer at any point during their treatment process. Good nutrition is incredibly important for patients during therapy. There have been many studies that have shown that patients who are able to support and maintain their nutrition during treatment have increased response to treatment, delayed or decreased toxicities from treatment. It helped prevent hospitalizations related to treatment, and overall just better outcome when good nutrition is maintained throughout treatment process. Patients need to focus on making sure they get adequate calories and protein as they go through treatment. Protein helps rebuild muscles and heal tissue, and it's important that they're getting adequate amounts of protein during this process. And that's usually what I do, is help patients figure out what protein foods can they get in and what's going to work for them. The best sources of protein are going to be foods like milk products, milk, dairy, yogurt, cheese, eggs, also meat, chicken, and fish, and beans, and nuts and peanut butter. Going through treatment, there's not really anything specific that people should avoid, but it's all on a case-by-case basis. So sometimes people have side effects related to treatment that affect their ability to eat certain foods, and then they would have to avoid those foods. So for example, if a patient is going through treatment and ends up having sore mouth or sore throat, then there are certain foods that they would avoid. For example, they would probably avoid citrus foods or tomato products, things that can burn or further irritate their sore mouth. Another example is if the patient is dealing with stomach upset or nausea, then there are certain foods that they would avoid during those times. The most significant examples of things to avoid would be high-fat foods, really rich desserts, because those can sometimes aggravate the stomach upset. And then overall, as foods that are important to include, as I mentioned, are the good sources of protein, and really just trying to make sure that calories are adequate during the whole process. When I'm working with patients, I want to know what vitamins or minerals or herbal supplements should they take. And for the most part, as you're going through treatment, and even anyone, whether they're on treatment or not, and whether they're dealing with cancer or not, doesn't really need additional supplements. The American Institute for Cancer Research recommends that we try to focus on meeting our nutrition needs through the use of whole foods as opposed to dietary supplements. So I think the most important focus for patients during treatment, after treatment, or at any point is to work on getting in a variety of foods, and foods that are rich in lots of vitamins and minerals. Of course, fruits and vegetables are famous for being very nutrient dense, along with other foods like whole grains, low-fat dairy, nuts and beans and legumes and peanut butter. So I would focus more on making sure you're getting in those foods as opposed to a supplement. There are occasions when a supplement is okay, and if a patient wants to take dietary supplements, vitamins or minerals, what I would suggest is reading the label, the bottle of the supplement, and looking for a product that has no more than 100% of the daily value for any nutrient. In this country, the supplements aren't really regulated by our government, so we have to be really careful with what we're putting in our bodies, because it may or may not be what the package says. And some supplements, for example antioxidant supplements, can interfere with chemotherapy and radiation therapy. So it's important to check with your dietitian or your doctor before you start any particular supplement. That being said, there are certain supplements that might be applicable to the patient. As I mentioned earlier, protein is really important going through the treatment process. So sometimes people take a protein supplement, and that is something that might be useful if you're struggling to meet your protein needs. So whey protein powder or soy protein powder can help you meet your protein needs. Again, I would just make sure that it's not heavily loaded with lots of other vitamins and minerals greater than 100% of the daily value. And then there's a lot of new information coming out on vitamin D and its importance in overall health and cancer, and so that might be a supplement to consider, considering the fact that we cannot get a lot of vitamin D from our foods, and we make vitamin D in our skin, but even during the winter months, as far south as North Carolina, we don't make a lot of vitamin D. So I think the most important thing is always to go back to your doctor or your dietitian and ask about specific supplements that you're interested in taking, and then have a discussion over what's appropriate for you in your situation. Another thing that's important for patients when they're considering using supplement is for them to be reviewed by the dietitian or the doctor. So what I always like to do is have patients bring in their supplements, the actual bottles or containers or labels, or bring in a list of what they're taking with the exact amounts written down, how many milligrams of whatever, so that then I can review it. And what I like to do is use several reputable databases that I can look up the current evidence out there on these particular supplements, and then provide the patients with a more specific evidence-based answer to their questions. And another thing that I also do is I work pretty closely with our pharmacists, who are oncology specialized pharmacists, and they can help me get a sense of whether or not the supplements are going to be detrimental to interacting with other medications that the patients are on. So I think one thing that patients don't often realize is that supplements can interfere with medications, not just the chemotherapy, but actual pain medicines or nausea medicines or whatever. And we don't want to make any of those medicines less effective by some supplement that we're taking. So it's important to look at the whole picture and get the whole team involved. Once treatment has been finished, it's important for patients to really focus on getting a nice variety and balance in what they're eating. The American Institute for Cancer Research has compiled all of the data so far internationally. They put out a report, I think it was in November of 2007, summarizing the data on nutrition and cancer. And their summary statements are that cancer survivors, so people who are not dealing with the acute effects of treatment, symptom management, but sort of past treatment, should focus on a plant-based diet. So what that means is about 2/3 of the plate should be plant foods. And plant foods includes, of course, your fruits and vegetables, but also beans, nuts, and legumes, and your whole grain foods. So focusing at least 2/3 of the plate on plant foods, and then the remaining 1/3 is going to be your animal products like your milk, your eggs, your meat, chicken, fish, all those kinds of foods. So I think it's important for people to try to work towards getting more of a plant-based diet. I don't think you have to be a vegetarian, but it's important to get in these plant foods. And the other reason for focusing on the plant foods is we know that they contain powerful cancer-fighting substances, referred to as phytochemicals. Antioxidants are found within these foods, and this is the best way to get them because they're the natural way that they are designed to be taken from the whole food themselves. So it's important to move towards a plant-based diet and do the best you can with the foods that you like to eat. If you think about your foods as a rainbow of color, each of those colors represents a different group of cancer-fighting compounds. The purple and red category of, let's say, fruits, so your berries, your blueberries, strawberries, blackberries, raspberries, your plums, even eggplant, in that category, those foods have what's called anthocyanins, which give the food their purple color, and that's a cancer-fighting compound in and of itself. So that's one important group to include. You also have your dark leafy green vegetables like spinach and kale and collards, all favorites of the South, and then also the broccoli family, which is broccoli and cauliflower, cabbage, those types of vegetables, which contain sulforaphanes, which are also cancer-fighting compounds. So I think pretty much any category of fruits and vegetables, you just want to go for the variety of color, and you're going to get all the powerful nutrients that are going to help ward off any future cancer. What happens to the patient significantly affects the family members, and this makes sense. Caregivers face a lot of stress as their loved one is going through treatment, whether it's a spouse or a child or a parent or whatever. It's difficult on the family as well. And I think probably one of the most important things for the caregiver to do is to not forget to take care of themselves. If you can't take care of yourself, then you're not going to be able to take care of or if you don't take care of yourself, then you can't take care of your loved one who's going through treatment. So, as I mentioned with the plant-based diet, I think that's also an important focus for the caregiver, the family members, because it'll help the patient once they're finished with treatment make those dietary choices and move to better health, but also it helps you to prevent cancer in yourself, to prevent heart disease, diabetes, and help keep you strong and healthy.